right, we've gone live. Hello, everybody. Dr. Alex Earl here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. Yeah, it's really good to spend some time with you guys, and of course, answer all your questions and go over very important plastic surgery topics. And today, I'm super excited because I finally get to talk to you guys about this. It's been about 2 weeks now. The last live and we're super excited about that. But today we're going to talk about everything that I learned when I went down to Colombia with one of the godfathers of HC Lipo himself, the guy that pretty much invented the technique. His name is Dr. Alfredo Hoyos. He's really a master at this. And of course, I'm always trying to get better and better and improve and really get the most up-to-date techniques and technologies in order to provide the best for our patients. So I spent a week down there and I had an awesome time. And I really want to talk to you guys about everything that I learned, everything that was confirmed, because a lot of stuff that I was doing, they were doing too, which is always good to see. And what we're going to be offering you guys here moving forward. All right. So today we're going to be talking about HD, high definition liposculpture. Okay. Colombian style. So not just any style, the way they do it, where Dr. Hoyos invented this procedure down in Colombia, okay? As far as I know, I'm the only total definer here in Miami. So, we did the course, then there was an exam, I passed the exam, so now I even have my certificate, which shows that I'm what they call total definer master, okay? All right, so what are we talking about? So we're talking about not just your kind of regular liposculpture where you're just kind of creating that silhouette, just creating that, let's say that hourglass figure for women and kind of that upside, that kind of that V shape, for men. It's not just that, we're talking about actually, bringing out the underlying musculature, okay? So high definition means we're defining the musculature for a more athletic look overall, okay? And that's really what it's all about. And it sounds potentially maybe a little simple, but it's quite complex, okay? Because of course, there's many, many muscles involved, there's many technologies involved, and there's many degrees as to how much we do this, okay? So how intense you want that high definition to go, all right? But before getting all that, one of the first things that they talked about, and one of the first things that I probably already knew, but it's the most important, is that one of the most important things you want to have a successful procedure is patient selection, okay? So what does that mean? Unfortunately, not everyone qualifies, all right? Just because we have the ability to do the HC lipo, just because the patient may want HC lipo, it does not mean that they qualify for HC lipo, okay? Because this has to be for a very specific set of patients, okay? So patient selection is very, very important. First thing here is BMI. This is not going to be for patients that are in the BMIs and they're 30 or above, okay? Actually, the best patients are probably going to be in a BMI of somewhere between 20 and 25, okay? That's going to be the ideal range for this specific type of procedure, okay? Now, that doesn't mean all liposuction, right? We're talking about HD lipo Colombian style here. We're very, very specific, okay? Yeah, of course, between 25 and 30, you can get your regular liposculpture and stuff that we do here day in, day out. But we're talking about this procedure specifically, okay? So BMI needs to be between about 20 and 25. Here's the next thing. You need a highly motivated patient. All right, this is the type of patient that will for sure enter a nutrition plan and a physical activity or exercise program after surgery. All right, that's incredibly important because otherwise you can have the greatest result on the table, and if you don't take care of it, if you don't do your post-op care, you don't do your nutrition, you don't do your exercise, you're going to lose it completely. Okay, not only that, but if you gain a bunch of weight, it's going to look very, very funny, very, very odd. Okay, so we need highly motivated patients that are going to be completely on top of their post-op care. That means your compression, that means your massages, and any other post-op modalities that need to be done in order to really, really bring out your results. And this also includes nutrition in the long term, okay? and exercise, okay? Hitting the gym, working out those muscles that have been just, defined by this procedure, okay? So we need lower BMI patients, we need highly motivated patients, okay? And the next thing is because typically these procedures involve multiple body areas, okay? And they can be a little bit longer. They can certainly be about 4-hour procedures in total if you're doing everything. We're gonna need patients where their hemo level has to be at least 12, okay? 12 or above. So for this procedure, we're not gonna be accepting patients that have a hemoglobin less than 12, okay? Like I said, these are relatively long procedures. They tend to be, it's not just Lipo 360, it tends to be the entire trunk, the arms, the thighs, we're really going to multiple areas, okay? So you want to make sure that you're healthy. You want to make sure that your hemo level is up. Now, there are 3 different types of Colombian style HD liposuction, okay? And it all depends really on how defined you want to be, all right? The most, kind of the baseline level is what we call basic HD liposuction, and we have a female patient that we're going to show you that's at the basic level. And most women, will want to do either basic or moderate. It's very, very rare that women are going to want to do the extreme type of HD liposuction, okay? Honestly, most women, especially at least here in South Florida, and most of the ones that we saw in Colombia, are opting more for the basic HD, which means that you have that central line here, that beautiful definition along the lateral edges of the erectus muscle, or the abs muscle, but you don't have like the six-pack, right? The six-pack going across. And most women like that because it's it's athletic, but it's very, very feminine as well. So for women, basic is definitely the most common, and then moderate, and it's very, very rare that we would do extreme. Now for men, it's a little bit the opposite. So for men, men are gonna be doing mostly moderate and extreme. Okay, we're gonna see those two more for men because extreme is when we're really defining a ton of muscles. We're defining the abs with the six-pack. We're defining the obliques. We're defining the obliques down here and the obliques through here. We're defining another small muscle that comes through here called the serratus. We're defining the biceps, the triceps, the deltoids, the chest, okay? The trapezius, which is the kind of the neck muscle, the one that makes you look like you have a nice thick neck. Your latissimus, which is your back muscles through here, and then your lower back muscles here as well. And even on top of that, we can define some of the musculature in the legs as well, okay? So that's extreme HD lipo there. There are 3 kinds of bodies, all right? So there's what we call the endomorph, and that's kind of your more obese patient, or at least a little bit higher in that BMI scale. And if you're an endomorph and maybe that BMI of about 25, you're not going to qualify for extreme, okay? An endomorph, if you're a little bit higher BMI, kind of more trending towards overweight or obese, you're going to be doing either basic or moderate. This is for both men and women, okay? Now, the ectomorph, that's kind of the biggest population for this procedure. That's just kind of you're at a good BMI, you're healthy, you've kind of worked out a lot, but you just can't see any definition. And if you're an ectomorph, you can actually qualify for all 3, depending on what is the style that you want. So you can have your basic, you can have your moderate, and your extreme, okay? And so Willie's asking here, what is he? He's actually more in the mesomorph, which is someone that's already pretty athletic, okay? But is wanting to have even more definition because it doesn't matter how many hours you spend in the gym and how much protein you eat and how well you take care of yourself, there's just certain muscles that are just not reaching that definition that you want. And so for the mesomorphs, you can qualify for moderate and definitely extreme as well. So if you're a mesomorph, you can qualify for that, okay? So those are the different body types that apply to men and women. And depending on the body type, it really depends what type of HD liposculpture that we can perform, okay? The good news is this is for men and women, okay? So of course, we do a lot of ladies here up here, our pearls. But now we've opened up this whole new thing for the guys out there. So guys, if you want to start looking, like you have a six pack, you want that athletic look, you're trying to get at the gym, but there's just certain areas you can't define. This is a beautiful, beautiful procedure for you. Okay. And the other thing that's being applied to men is that not only are we kind of defining the musculature that you already have, but we can, listen to this, we can enhance your muscles by doing what they call U-graft. U-graft stands for fat grafting under ultrasound imaging, okay? And we can add a little bit of fat into the muscles, okay, to basically make them larger, all right? And so where can we put fat? We can put fat into your pec muscles. We can put them into the individual kind of pockets from the six packs or each individual pack. The obliques are an area where you can put a little bit of fat. You can certainly put some fat in the trapezius to get that kind of thicker neck. And we can put some fat into the latissimus, which is along here, to give you that wider kind of V-shape back. All right? Now, there is one muscle where you absolutely do not ever want to be putting fat. And I talk about this a lot, so I'm going to give you guys a guess here. What is the one muscle you must never put fat into? Let's see, any answers? No, biceps we can put fat into the biceps.
Calf?
We can do the triceps, okay, and the deltoid. Calves, calves are tricky. You don't want to be putting a lot of fat into calves, but no, come on guys, the one that I talk about all the time.
Glutes?
Of course, there you go. You're right. You never want to put fat into the gluteal muscle, right? That's what we talk about when we do a BBL. That's not safe, right? When you're talking about, enhancing the buttock, you want to be in that safe space between the muscle and the skin. You never want to put fat in the gluteal muscle because then you can get a fat embolus. So now you're probably asking, well, doc, what's the difference, right? Why would you never, ever, ever put fat in the gluteal muscle, in the gluteus maximus, but you would put some fat in these other muscles? And that has everything to do with the vasculature, okay? So the gluteal muscle right underneath there has these very large vessels called the superior and inferior gluteal artery and vein. And these vessels can be 3 to 4 millimeters in diameter. They're very, very large. Okay, not only that, but if fat gets into these vessels, there's a direct route to the lung, causing the fat embolism, and it could be deadly. Okay, so not all muscles are made the same. Gluteal muscle, it's extremely dangerous to put fat in the gluteal muscle. You never want to do that. It's what I've been preaching for years and years and years. That's why I use the ultrasound imaging to make sure that I'm not in the muscle when I do a BBL, okay? But these other muscles, okay, they don't have the large vessels, okay? And they also don't have a direct route to the lungs. So as long as you can, of course, you have to do it under imaging as well. You can place some fat into those muscles to essentially bulk up the muscle. And this is a lot more, you don't really see that with women, because women want to have kind of that thinner kind of athletic look. But with men, they want to look a little bit more bulky. And so you see that with the men. And so that's something that we're going to start incorporating here as well. So we can physically grow your bicep, grow your tricep, grow your deltoid, grow your pecs, etc. In the operating room. And this is what has been very interesting, and something they found in Colombia and Brazil, where they actually came up with the U-graft. The U-graft was actually created in Brazil and taken up by Dr. Hoyos in Colombia. But what they've shown is that those patients that have had some fat placed into their other musculature, when they then go back to the gym and start working out, they find it easier to bulk up, which is super, super interesting. And there's a lot of data coming out regarding that. So it's really, really, really cool. As far as I know, nobody's doing this in Florida, okay? As far as I know, yeah. They're doing it in Brazil, where they invented it. They're doing some in Colombia. I haven't seen anyone do this in Florida. So I've trained on this now, and it's going to be something that we're going to start offering here as well. So for all the guys out there, if there's any guys watching, check this out. Okay. Now, Next, the next thing that I learned out there is that they use multiple technologies. A lot of them we're already using here, which is great, but we're going to be adding one more, and I'm really excited about this, okay? So when they're doing this procedure, like I said, it's like a whole body procedure, and it involves multiple technologies. It involves a micro air, which is a power assisted liposuction, and involves the Vaser, which uses ultrasound energy, okay, to help with the skin retraction and with the fat removal, and it also helps decrease blood loss. All right, and that's the one that we don't have here now, which we're about, which we're going to be getting very soon, so that we can perform these beautiful procedures. Okay, they also use the body type to further help with skin retraction. Okay, and last but not least, on top of the body type, some patients are also receiving the Morpheus. So we've talked a lot about body tight and Morpheus here. We're actually the #1 clinic for body tight and Morpheus here in Florida. We do the most of these procedures throughout. And so it was nice to see that they're also using these technologies to help with skin retraction down in Colombia. Okay? And last but not least, what I've been talking about since 2019, right? Ultrasound imaging. So I use the ultrasound to make sure that we're in the right spaces when we're either putting fat in those other muscles or avoiding the muscle when we're talking about a BBL and placing fat in the gluteal region. Okay, so look at this: 1, 2, 3, 5 different technologies for one patient and one surgery to really try to come up with the best results. And a lot of this has to do with skin. So I didn't mention it here, but if you have loose skin, poor quality skin, unfortunately, you're not a candidate for this procedure. Okay. You have like that flap, you're a massive weight loss patient, you have a flap of skin hanging down, you're not going to be a candidate for this procedure. You've had multiple pregnancies, you have very loose skin with a lot of stretch marks and it's all thinned out, you're not going to be a candidate for this procedure. You're older, you smoked all your life, you've been in the sun, you have that thin, crepey skin, you're not going to be a candidate for this procedure. Okay? The skin quality is extremely important. You have to have good skin quality to qualify for this procedure. All right. Now, some patients though, maybe the skin quality is not bad, it's just a little overhanging because of multiple pregnancies. Well, your first step is going to be to get your tummy tuck. You get your tummy tuck, all right. You fix the skin issue because you get rid of all the loose skin. You make things nice and tight again, all right, and then you can qualify for this procedure. So you definitely need to get your tummy tuck first. For this, no exceptions. Okay. If you have some loose skin, tummy tuck 100% needs to be done first, and then you can get your high definition liposculpture Colombian style. Okay? All right. So that leads me to what we're going to be offering here at Pure, and I'm going to talk about this in a sec, but first I want to show some cases to the Pure Total Definer package, and we'll talk about that. But first, let's take a look at what we did. All right, so we're going to take a minute here as we turn the cameras around.
Yes.
Okay, so I want you guys to look at the screen, and what I'm about to show you here are the actual patients, the real actual patients that we did in Colombia. Okay, so these are the patients that we worked on, all right, in Colombia, and we're going to show you here. We actually did 4 patients down there. There was 2 male patients and 2 female patients. I have the photos here for the 2 male patients and 1 of the female patients, but I want to show you like the actual befores, the actual markings, and the actual on the table afters, all right, of what we did in Colombia 2 weeks ago. Okay, so this is our first male patient right here, as you can tell. And the first thing you're going to immediately notice is that, like I said, it's a full body procedure. All right, so when we talk about the Total Definer package, it's going to be a package that involves pretty much anything that we need to do in order to get you that look, whether you want to be in that kind of that basic or that moderate or that extreme high definition look. All right, so it's not going to be like typically we do, like, okay, you want Lipo 360, do you want to add arms, do you want to add thighs? No, it's basically one package that basically where it all comes included, and we have to do whatever it is we need to do, to get you that look. Okay, so for this male patient, you can see the markings here. So we're going to be defining that 6-pack, right? So the 6-pack, oh, this is a key. Look, did you guys know, like, and you probably don't even think about it, the six-pack is always at and above the belly button, okay? I see surgeons all the time making six-packs below the belly button. It's completely not anatomical. It is wrong. Do not do that, okay? The six-packs do not go below the belly button, okay? If you see someone with a six-pack below the belly button, you know it's fake. It's a telltale sign, okay? So, six-packs always at or above the belly button, okay? And then here, then we're defining the abs. In this patient, then we're defining what we call the obliques, which are the ones that come through here. So the oblique definition there, we're definitely going to reduce that waistline to create more of that V shape. We're going to be reducing some of the excess fat in the chest area and adding fat to the pec muscle up here. That's where that purple is. So it gives you that kind of that big kind of chest Superman look. You can't see too well here, but we added fat to the deltoids. So you get those big kind of broad shoulders and some fat here to the biceps as well. So you get a bigger bicep, okay? So there's a few key things here that I want to point out. When you're doing HD lipo, guys or girls, all right? One of the things that I did learn in Colombia is that you have to flow with the patient's anatomy. And I was like, yeah, like remember, you guys know what I'm talking about when I talk about SOE-BL and a lot of the procedures that we do here, that it's all about doing it according to that patient's foundation. I mean, that's exactly right. And they believe the same thing down there as well. So if you have certain asymmetries because you're just naturally that way, and believe me, most people, their six-packs are not perfectly symmetrical, then we got to go with their natural anatomy. So small asymmetries are actually okay. That's how people are built, okay? You look at athletes out there that show their six-packs, you're going to tell they're going to be shifted. They're not going to be perfectly the same side to side. So we got to flow with the patient's foundation, with the patient's anatomy, and if they have certain asymmetries because their muscles are asymmetrical or their skeletal foundation is asymmetrical, then that's okay. That's just the way that you're built, and we're just going to keep, we're just going to enhance that, okay? So you are going to see certain symmetries. For example, in this patient, this pack is a little higher than it is here, but that's just how his musculature is, and that's what we're going to be working with, okay? And now we're working not just the front, but the back and the arms, okay? So obviously, the patient has too much fat down here, so we mark that off to remove a lot of the fat in the waist area to get some of that V-shaped definition. We're going to define sort of those lower back muscles here. We're going to define the trapezius, which are the big neck muscles, and add a little fat here and here to give you that kind of that bulky, thicker neck. Fat's being added to the deltoids, okay, the shoulders, and the biceps and the triceps, okay? Triceps are being defined as well. Back is being kind of scooped out. And in this patient, fat's going to be added to the gluteal region, not in the muscle, in the gluteal region, right? So not in there, and a little bit of extra fat to the upper buttock because men tend to have short buttocks, okay, kind of compared to the rest of their body. So one of the things that you want to do is you want to kind of build up the buttock, especially in that upper buttock region there as well, okay? So this is the patient that we did, and here's the patient after the surgery on the table, okay? He had what I would call the moderate type of HD liposculpture. So you can see some nicely defined six-pack, waist is shrinking down, six-pack is turning to that V down into the pelvic area. The chest, it's puffed out here where we added the fat. Everything else has been nicely scooped out, all right? Biceps and the deltoids have been, given more volume with some of the fat transfer there. So beautiful, beautiful result, okay? And then in the back, yes, we're giving a little bit of volume more to the buttock area. And then we're defining those lower back muscles and really defining and kind of elongating the buttock just a little bit to give you that nice definition between the lower back and the upper buttock region there as well. And it's hard to tell in the photo, but fat was added here and here to that trapezius muscle to bulk it up. Okay? Beautiful on the table result there. All right, here we have another male patient. This male patient was slightly older, but he wanted, to have more definition. And now you can tell as you compare it to the previous patient, right? the markings are not exactly the same. So why is that? Again, because we are going along with the patient's anatomy, right? We're going along with their foundation. We're not just putting a tic-tac-toe board up there, right? Okay, you don't want to do that. You want to go with their own foundation anatomy. So his six-pack looks a little bit different because that's what it actually is underneath there. It's what we actually palpate, okay? But once again, defining the six-pack, removing the fat underneath the chest. If you have a little bit of gynecomastia, we can deal with that at this time. We can reduce some of the excess fat and sometimes breast tissue that men may have in the chest area, okay? Once again, reducing the waist, okay? Defining the obliques down here, adding fat to the pecs, adding fat to the biceps, okay? The back, we're gonna define those lower back muscles. We're gonna add a little fat to that neck, okay? To the deltoids, all right? And then to the tricep as well. And then here into the buttock region just to give it a little bit more volume, not in the muscle. Once again, I'm like a broken record here, right? But it's super important you guys understand the difference there, okay? All right, and here we go, on the table. Now the difference here, so this is something that they did. I'm not sure if I'm gonna do that here or not. It looks a little bit, but they, in order to like really kind of create that indentation down there, they put a few sutures, a few stitches there to kind of hold it in place. It's only gonna be there for the first 48 hours, and then after that they'll be removed, so it's not gonna leave any marks. I don't know that we really have to do that. I think we can use some foams and taping and other measures, so I'm probably not gonna be doing that here. But you're gonna see very well, look at the six-pack right there. Boom, 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 boom. Very nice. You have that nice definition in between there, all the way up. Chest is puffed out, waist is brought in, nice V shape. He's gonna love it. Okay? And then same thing on the back. Look at these deltoids now. All right, there's like those Superman deltoids. Okay? Deltoids are here and here. Okay, and lower back defined, a little bit more volume to the buttock region. All right, so now let's talk about women. Okay, so for women, we're gonna be, like I said, we're gonna be doing mostly basic, maybe moderate, but we're not gonna be doing those extremes. All right, we're not gonna be doing fat grafting to other muscles either. And so for the women, typically most women, they like to have that line in the middle and that little definition along the sides there, but not the six-pack going across. Okay, so we're going to be defining along here and here. You can see the markings there. Definitely we're going to shrink the waist as much as we can, right? You want to have that nice, beautiful curve, that hourglass shape, okay? We're going to be doing, further lipo to the arms. The lipo to the arms is essentially 360, so not just the lower part here. So we're going to be defining the arms. You're going to be defining underneath the breast there, okay? And sometimes you can even define, the thighs a little bit more as well, bringing in some of that excess fat that we typically find in that inner thigh area. Okay. And here you go, beautiful, beautiful definition. So she doesn't have the six-pack, right? This is more like the basic, very feminine, athletic, feminine, healthy. So you have the definition through here and here. You see the lines in the center there. Her what we call the iliac crest, so the bikini bones, if you will, right? Where the bikini goes have been enhanced. So that creates a very beautiful feminine look. Very, excellent for when you want to wear a bikini out on South Beach, right? And so that's very, very important, okay? This particular patient had a prior C-section, so that's a prior C-section scar there, okay? So one of the key things about this procedure for both men and women is where you're placing the incisions, okay? And it has to be in places where they're gonna be easily hidden. So underneath the breast, the patient's, there's not gonna be hidden, not gonna be seen there, okay, because it's covered by the breast. These are gonna be very, very low in that suprapubic area. And the other one is tucked inside the belly button. So very hidden incisions, even if you're wearing a small bikini, okay? And then this is the markings for the back. So again, you're going to define some of those lower back muscles, excuse me. You're going to continue to shrink in that waist from the back. All right, continue to do some lipo for the arms because like I mentioned, you're going to do the 360 arm lipo. And then of course, you're going to enhance the buttock and the hips, which is kind of part of your BBL, which is what we do here day in and day out. Okay. Again, you don't want any incisions, and it's what I've been talking about for a long time now with the South Beach butt lift, right? You don't want any incisions in the back for a woman, okay? So the one incision is going to be hidden here in between the butt cheeks, and the other ones are going to be placed right in here in the armpit area, tucked into that armpit area, very well hidden, which leaves the entire back with no incisions, okay? And then we do have the ones for fat transfer, which are going to be down here, hidden in that gluteal crease area. Okay? Oh, look at that. Beautiful shape, hourglass shape here. Definition of the lower back muscles. The arms are thinner and more well defined. She's got that beautiful curve here. And these incisions well hidden in that gluteal crease area there as well. Okay? So these are the patients that we actually did in Colombia. It was really awesome. And this is what we're bringing here to Pure. All right? So what does that mean? Well, that means the Pure Total Definer package. What is that going to include? That's going to include high definition liposculpture, whether it's basic, moderate, or extreme. All right? Of all the areas that need to be addressed. So it's going to be a lipo 360 and the arms, and if it's a guy, it's going to be the chest. So arms, chest, back, abdomen, flanks, waist, okay, and even lower extremities, inner thighs as needed, okay? It's going to include of course, the micro air, power assisted liposuction. It's going to include the Vaser. It's going to include the Body Tight. And if you need it, it's going to include the Morpheus as well. So it's going to include all the technologies. And of course, everything done under ultrasound guided imaging so that we make sure that we're doing this safely. Okay? So it's a huge deal. I mean, you're getting like 5 different procedures in one to obtain like this, the body of your dreams. Okay? But if we're doing all this work, right, and we're putting all this into it, after surgery, it's your responsibility. Okay? You have to get into that nutrition plan. You have to follow all of our post-op instructions. Okay? You're going to need 20 to 30 massages as well. Okay? Your compression, your massages, your nutrition, and your exercise program after you're cleared to exercise, so after 6 weeks. All right? Awesome. So, I talked for a long time. All right? So, but I just wanted to I was so excited about this. I really wanted to show you guys what we did, what we've learned, and what we brought back here to Pure. And I'm happy to answer any questions you may have regarding this.
Okay. Let me find the questions for this topic, starting there.
All right.
Okay. How this will work with your South Beach butt lift?
Right, so it's beautiful. The South Beach butt lift will be beautifully incorporated into this because there's a lot of things that we were doing with the South Beach butt lift that is already kind of part of this. Number one, we were tailoring it to your unique and underlying foundation, right? And that's a key thing about the HC lipo. Is something that they thought was very important. I've been saying it's very important for a long time. You don't want to look like something was just stuck on there like it doesn't belong. So we're going to be following your beautiful natural curves. Of course, everything's going to be enhanced, all right? But we're going to follow that underlying foundation. Number two, where we place the incision, especially in the back, exactly the same as the South Beach butt lift. We're still placing very few, very minimal, and always hidden incisions. One in between the butt cheeks here, 2 in the armpits, nothing in the back at all. And we're going to keep also those hidden incisions in the front as well. Third, South Beach butt lift, of course, we're always using the ultrasound, which we're going to continue to use for this. And we're going to be placing that fat when we're doing the gluteal augmentation in that space between the muscle and the skin, which is that safe space. So it can definitely be incorporated with that. So we can do the HD liposculpture with the South Beach butt lift. And like I said, it's a total definer package. So it includes all of the above.
What's the BMI requirement for the total definer?
So the BMI requirement is going to be BMI between like 20 and 25, okay? Could there be some exceptions above 25? Yeah, there can be some exceptions, right? BMI is a crude number. Some patients maybe already, especially for men, they already have a certain amount of muscle mass, and so their BMI may be higher, and all that requires a definition. So, we want to then be able to do an evaluation. So if you're interested in this, okay, and your BMI might be just a touch higher than 25, go ahead and inquire, and that way I can look at your photos and I can determine if you're going to be a good candidate. All right. Now, if your BMI is like 35 or above that, you're probably not going to be a candidate. Okay. But yeah, for women, probably between 20 and 25. For men, I'm sure we can probably go up into 28, 29, especially if they already have a certain degree of muscle mass.
Okay. Can you do this with a tummy tuck?
So you can do it at the same time as the tummy tuck, okay? So like I said before, if you have skin quality is one of the key issues in terms of patient selection, okay? So you have to have the good quality skin in order to do this. And so if you have loose skin, then you need to get your tummy tuck first, all right? No exceptions for this, 100%. You need to get your tummy tuck first, get that skin quality under control, get things nice and tight, all right? And then you can come back for your total definer package.
What does a tummy tuck scar revision consist of?
So a tummy tuck scar revision is when we're essentially cutting out the old scar and closing everything back up, creating a whole new scar essentially that then we're going to really stay on top of so that the same thing doesn't happen again, right? Typically, we're doing a revision because you had a hypertrophic scar or a keloid scar, okay? So we're going to remove that old scar, we're going to close things back together again, and then we're going to be very, very diligent about your massage, using your silicone-based creams, and then potentially even injecting some steroids if needed to prevent it from becoming a keloid again.
What's the downtime for breast augmentation, and where do you do the incisions?
All right, so I don't know if you guys saw one of my recent stories when I was doing a breast augmentation, and I did a tiny incision, which I think was like 2 centimeters, okay? So my preferred incision is in the IMF, so in the inframammary fold, okay? But the way that you want to do it, I can do it in such a way that that incision is literally 2 centimeters. Very, very tiny incision through there. And that's all we need in order to create the pocket and place the implants. So if you want to have a barely noticeable, very small incision, make sure you come to us for your breast aug.
Is the 4 liters still the same for the amount of fat?
Yeah, so that's a Florida rule, right? So the Florida Department of Health, sets certain rules and guidelines that we have to follow in what we call office-based surgery, which is what we have here at Pure. So for the total definer package, the same rules apply, right? So the max amount of fat that we're going to be able to remove would be 4 liters of supernatant fat.
Okay, many people asking about pricings and bookings and how can they get a consultation. So
yeah, of course. So that's what we're excited about, right? This is brand new. We're offering here at Pure. We're super excited to roll this out. And so really the best way to do this, and I'm not sure we can we go back to the board?
Yes, we can.
All right.
A little movement here.
Let's go back to the board just to make sure. All right, so for that total definer package, and any other procedure that you may be interested here at Pure Plastic Surgery, and also whether it's with myself or Dr. Vidal or Dr. Wiegeriff with our new surgeon, which we're super excited about, the easiest thing to do is to go to our website. So www.pureplasticsurgery.com. Okay, so you're going to go to the website, and I'm telling you the easiest way to get in. There are other ways, but this is the easiest way. When you go to the website, you're going to see a link that says virtual consultation. Okay, you're going to hit that link. You're going to end up where there's a questionnaire, and it's going to ask you a few questions you have to fill out. And it's going to ask you to send your photos, okay? So you're going to fill out that questionnaire, you're going to send the photos, it's going to come to one of our patient care coordinators here, and then she's going to reach out to you, all right? And she's going to give you all the information that you need. All right, a couple things you need to know. Number one, say you're interested in more than one procedure. Say, for example, you're interested in, I don't know, a breast procedure and a tummy tuck, right? And the form only allows you to place one. It's okay. Don't worry about it. All right, just put in one of the procedures. All right, because when the patient care coordinator reaches out and talks to you, she'll be able to square that away. It's not going to be a problem. All right, so as long as you place one of your procedures there, then everything else is going to get handled. All right. The next question that we get, well, doc, what if I want an in-person consultation? Yes, we definitely do in-person consultations, but the easiest way to get a hold of us is to go through here, send your information, send your photos, then your coordinator will reach out to you, and if you tell her, hey, I want to do this in-person consultation, she'll be happy to schedule that in-person consultation for you, okay? We have 3 different types of consultations here at Pure Plastic Surgery. Number 1, we have the virtual consultation, which involves the questionnaire and the photos. Number 2, we have your video consultation, right? So a lot of our patients are from out of town, out of state, out of country, okay? So we can do a video consultation. And then number 3, of course, are in-person consultations. So we have all those options available to you, okay? Now, and then of course the other thing that you can do, last one, you can always call us too, okay? Do you understand my handwriting? Oh boy. All right, 305-230-4326, okay? That's our office number as well, all right? But the best way, the easiest way, the most straightforward way is to go through the website and to hit that virtual consultation button, okay? All right, guys, who's excited about this? Yeah. Definitely, I'm definitely excited about this. We're bringing something new to South Florida. We always had our patients say like, hey, they do this and this and that in Colombia. Why don't, surgeons in the U.S. don't do it the same as Colombia? Well, we're bringing Colombia to Miami, okay? Colombia to Miami, and we're gonna do it even better. Okay, so I'm super excited about this. If you're interested, please go ahead and send in that virtual consultation. All right, and I look forward to seeing you guys hopefully here in the near future for some HD, high definition liposculpture. All right, everybody, I will catch you guys next week on Hump Day with Dr. Alex Earl. Ciao.